Since most non-essential travel is on hold, you'd be forgiven for thinking that immigration isn't really an issue during this COVID crisis. But it is for people here in the country awaiting status, for refugees in uncertain situations, for international students, and many others as well. Joining us now for their insights on some of the more vulnerable groups, we welcome Francisco Rico-Martinez, co-director of FCJ Refugee Centre. He's in his office in Oakwood Village in Toronto. And Rupaleem Bhuyan, associate professor in social work at the University of Toronto and a member of the Rights of Non-Status Women Network. She's at her home on the Danforth in Toronto. And it's great to have you two with us tonight for this important and timely conversation. Francisco, I wonder if you could just start us off by sort of breaking down for us who, in your view, are sort of the most vulnerable groups among us today in this COVID crisis.
Thank you for the invitation first, Steve. The groups that are the most vulnerable are, and we know this in our office because we are dealing with the issues every day, are the migrant workers. And migrant workers could be defined as a person that come to Canada to work. And some of them, they have a legal status. Some of them, or work permit. Some of them, they are here to work, but they don't have any legal status or any rights or social rights in Canada. International students are very vulnerable because they have to do a lot of investments to come to work, and they don't find a way to survive here because everything is closed, and they are the first to be left go in any of the business or places of work, and the families of non-status and international students are at home, and they don't have even food to put on their table or money to pay the rent.
Let me jump in for a second, Francisco, because you used a term there, and I want to make sure everybody understands all the terms. You talked about non-status as opposed to refugee, as opposed to immigrant. Can you settle it all for us?
Yes. For instance, non-status is a person that come to Canada, sometimes trick, sometimes because they don't have an option and to work, and they don't have the possibility to be regularized in Canada. They don't have the possibility to make an application to become a permanent resident or something, but they are working, and they are working in our society. Refugees are fleeing persecution, and they come to Canada and they try to make a claim for protection, and they are staying for the period of time legally in Canada. You have refugee claimants, you have refugees that are accepted overseas and brought it to Canada legally as a permanent residence, but it's always a confusion. The people is calling everybody a refugee when in real time we have migrants. Migrant workers, we have non-status migrants, and we have refugees in different categories as well.
Okay, thanks for that clarification. Rupaleem, let me just get you to amplify on that and tell us from your vantage point in what ways COVID-19 has affected these vulnerable groups within us.
Yeah, thank you for having me, Steve, and also glad to be here with Francisco and the work of FCJ Refugee Centre. I think that part of what we've seen across Canada is how this pandemic has shed light on existing inequalities and really exacerbated some of the vulnerabilities of groups. In the case of immigration, Canada has a long history of welcoming people to settle permanently in Canada, but in the last 20 years has really markedly increased the number of people who are admitted, meaning they are provided a resident permit to live, to work on a temporary basis or as international students. And as Francisco was saying, there are some also applying for refugee status or humanitarian claims. And the numbers are quite phenomenal. So in 2019, an estimated 1.2 million people were living in Canada with a temporary resident permit. Many times these folks are here and permitted to live temporarily. The vulnerability comes in if their ability to remain in Canada is tied to an employer. It creates a lot of inequality, especially folks working in low-wage jobs. We see this in the agricultural sector. We see this in kind of the essential services, everything from grocery clerks to people working in food industries, and those work conditions are already a challenge, especially if employers are not providing safe work environment or personal protection equipment. And a lot of those workers are also likely going to work. They don't have the option to stay at home. So the vulnerability is exacerbated. We also see conditions where employers putting pressure for maintaining some economic output are compromising the safety of their workers. Some of the agricultural workers who came on seasonal permits, so they're allowed to enter Canada for the growing season, they were required by law, by the government, to quarantine their workers. But the employers didn't always provide adequate food, however. So what does it mean when employers who are housing workers are abiding by the regulations to limit the spread of COVID by enforcing a quarantine, but not providing adequate health or food during that time period? And that's just an example of some of the inequities that are exacerbated. We also see the risk of losing status. People who enter Canada with a permit, it's so easy to fall out of status, to not have the fees or the funds to pay to renew your permit. If you need to change employers, I've seen this in my work with migrant caregivers, the time it takes to find a new employer, because their permit only allows them to work with one person, it's a closed permit, and then to apply for a new permit can often take up to 8 months. During that time period, people are not eligible to work legally, and they also aren't eligible to a lot of the financial assistance that's available, like through the Canadian Emergency Relief Fund. So I think
Actually,
there's a
since you
lot of
raised
ways
that, yeah,
that
let me
these,
pick up on that.
sure.
I want to pick up on the CERB because, yeah, we'll take just one program. The Canada Emergency Response Benefit has obviously provided a lot of economic relief to those who need it. Francisco, are immigrants, are non-status people, are refugees, are they eligible to receive the CERB?
In some occasions, yes. Some people, yes, but the majority of them, no. For instance, the person that is working without a work permit in Canada, they don't receive an employment record. They don't have a social insurance number. They don't have all the needs to apply, even though they have been working here for sometimes many years. Refugees that just arrived, they haven't received the work permit yet. They haven't received the social insurance number yet, even though they are working and trying to survive. Students, international students, they don't qualify because the hours that they have been working when they are studying don't give them the possibility to qualify under the record, and they are not making enough money to save $5,000 to apply. So migrant workers, forget it. They are not even here. And if they are here, they are in the farm and they don't speak the language enough to understand that they may qualify in all of these areas. So the whole program of benefits is not target, is not leading to the people the most in need, that is the migrant workers, the refugees, the international students, and people without status that are here. So that's why our slogan in our office is, we don't want to leave anyone behind, because this is a public health issue. If we left someone behind, this is going to come and haunt us as a society, because that person may be in a vulnerable situation or double their vulnerabilities.
Rupaleem, just help us understand, if they're not eligible for the emergency response benefit, and if so much of their existence here, for example, may be tied to a job that no longer exists, how are these folks managing right now?
Right, and I think I think the benefit is incredible for people who have a SIN number and are able to apply, who are eligible and have the means. Maybe they have the computer technology, since it requires that, as well as the support to apply. Anyone who doesn't have a current SIN number could include, as Francisco was saying, international students who have their study permit expired, temporary foreign workers who their work permit has expired. They still have a valid status to remain. There's a time period where they can reapply, but they're usually without a SIN number during that period. And then we also have many workers, people who've been living in Canada. We don't have an actual number. The estimates are between 500,000 or 1 million who are non-status. Many of these folks work in these essential jobs. They're doing personal care work, they're working in grocery stores, they're cleaning businesses. So they're often at risk, but they don't have either the financial assistance to stay at home, and they don't have the health insurance often. So there's a kind of a double vulnerability there. And there are mechanisms in place. So like the Migrant Workers Action Alliance is recommending we're using a tax ID number. Since many workers do file for taxes, this number is available and could be a mechanism to distribute resources without having to go through the income tax, which is more exclusionary to people with a SIN number.
Tomorrow night, we're going to do a program on the fact that disabled people in our midst are really disproportionately feeling this COVID crisis, particularly, obviously, if they live in long-term care homes, for example. So we'll do that tomorrow night. But I do want to ask, Francisco, I'll start with you on this. I do want to ask you whether you have evidence of the fact that people in this precarious situation that you've described are also disproportionately either getting COVID-19 or are affected by it in some other way.
Yes, and you just have to see where they live. Many of them are in shelters, and the crowded spaces are refugee claimants, are people without status, are people that are having made a claim, or they don't find a job and they are put it on the street by the landlords. Why? Because many of them live in a very non-legal setup of houses or these rooming houses that are properly licensed. So the landlord can call the police and say, we have an intruder here, and put it on the street. So we have many people that are there, and we know that this is where the COVID-19 is doing. The other thing that is happening is that they don't have they don't believe that it's possible for them to go to the hospital without being reported to the authorities. And so we don't know how many people is just holding in, you know what I mean, and staying at home and trying, because for them it's very precious to be in Canada because it's no future if they go back to their countries. So
Well, I got to follow up on one thing you said there, though, Francisco, which is, Premier Ford has said there is a prohibition on kicking anybody out of their apartment right now for any reason. Are you saying that's happening to non-status or immigrants or refugees right now?
Yes, it's happening, and it's happening. People have been calling the police, and we know because people phone us. Some landlords are saying, if you don't go, we are going to call the authorities. We are going to call immigration. We are going to put you in detention. We are going to do this and that. We are going to report you to the authorities. So the people, sometimes they don't call the police because the person leave, because they know that they will be at risk, which is not true, because the immigration and CBSA, the Canadian Border Services agencies, are not detaining people right now because they know that if they move people to the detention center, they are going to meet this crowded and the conditions are going to be out of hands. So they are not detaining people. But the ordinary migrant, the non-status, the refugee claim, they don't know about this. And therefore they are scared, and that creates, again, increase the vulnerabilities of these people.
Okay, Rupaleem, I want to ask you about children, because we know that the Canadian Child Benefit has been bumped up at this particular time to help with additional expenses, with kids staying home much more than they otherwise would have been because our schools are closed. Do you know whether any of the groups that we've been talking about here tonight are also eligible to receive the bumped up child benefit?
Right, and I think that the benefit is helpful. I think the CERB has really showed the kind of basic income that's been allocated during this emergency crisis is quite higher than some of the social assistance provided to low-income families. I think it is necessary to maintain this additional funding for the child benefit throughout the duration of the pandemic. So that's something I know Campaign 2000, an anti-poverty campaign, has been calling for. We also need to pay attention to the families that are excluded, because many jurisdictions are requiring the parents' immigration status to be reported and to be valid. Many children who are born in Canada, across Canada, may have a parent, one or more, who have a precarious status, either a temporary status or they're out of status currently, or they may be undocumented. And these families are currently being excluded. So we need to ensure that all children have access to this, irrespective of their parents' immigration status. And this is true in Ontario as well as other provinces.
Let me
And
follow up with, yes,
Steve, can
Francisco,
I?
please. Yes.
And there are Canadian-born childs, and they don't have access to this because they are born to non-status parents, and there is no possible to make an application for receiving this. And we have been trying through Ontario Works and different things, and the Ontario Work is saying, well, if the parents don't have a status, sorry, we are not going to accept the application, and the child is put it in a very difficult situation, and they are Canadian children that are not receiving any of the benefits that were defined for Canadians and permanent residents.
Rupaleem, I want to shift our conversation a little bit here to what the groups that we've been talking about may be feeling when they see, for example, and I'm not being critical of the police here, this is their job, but there are more police now roaming through the streets, roaming through our parks, trying to ensure that people practice physical distancing. They are giving out tickets and citations for people who don't do that. But if you're a non-status person here, or if you're a refugee here, and you see the police coming by, do I infer from that 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 creates more anxiety than it would for anybody else?
Absolutely. I mean, even before the pandemic, the threat of deportation, even if people have legal status, is such a powerful force that intimidates people. And on the one hand, many people who have a precarious status or non-status, they're working really hard to become permanent residents. They don't want to have any engagement with a law that would create a problem, much less lead to a detention or deportation. What that means is people are afraid to do things that everyday people may take casually, like jaywalk or cross the street between intersections. What I've seen is even some of the caregivers that I work with, people who work in homes and are still providing care for children or elderly, they're afraid to leave the home to go for a walk during their work hours with the children they're caring for, even if the parents are busy occupied in different parts of the house with their paid work, because they're afraid that they will be seen as violating these stay-at-home orders. And that puts both mental stress on them as well as the people they're caring for. So that's just one example of how the fear of intimidation. And we also see, unfortunately, in different parts of Toronto, the kind of history of racial profiling and the unfair kind of treatment, the brutality against especially Black and darker skinned racialized youth and men is reinforcing kind of an inequity. I know some of the parks in the neighborhood where I live, I see lots of people, especially young groups of people gathering in the park, and I've always been curious to see, well, who's paying attention? Unfortunately, I know in different parts of Toronto, they don't have, even individuals who are walking around can be intimidated or harassed if their skin color or the region that they're living in is seen as a problem by the police. So I think we
And
need to really pay vigilant attention that the policing measures don't reinforce this racial discrimination as well as intimidate immigrants who may have a precarious status.
Steve, can I say
Please.
the majority of families that are non-status and have a low income, they live in a very tiny places and they have families. And the whole trip for the holidays was to go to the park. And now they are scared to go to the park because the police is there and the police is ticketing and asking for IDs and whatever. So what they are doing? Nothing. And this is coming back to the trauma that they have been living back home as well, where they were not allowed to leave to their places or anything because war, because oppression, repression, anything. So this is a very difficult situation that we are facing, though.
I would assume, though, that there's a moratorium on deportations right now. I mean, the airlines are barely flying at all. You can't exactly kick people out of the country, Francisco. Is that not the case?
It is the case, and we are very happy that they have extended the moratorium. But who knows this? You know, I know this, and if somebody phoned me and I said, "Relax, everything is okay, nothing is going to happen, we have a space and whatever," but How many people have the possibility, the privileges to talk in their own language to someone that needs some knowledge about immigration and refugees and no deportations and no detention? That's a privilege issue. And the lawyers are, the office of the lawyers that they have a contact are closing down, and they are reducing the way that they are dealing with their clientele as well. So the services for people that are marginalized have reduced because the services that very few offices that we were working with non-status people is still open and is still providing services even remote and physically distant, but we are providing so very few, so they are in isolation. That's the problem.
And if I
Rupaleem,
could add, I think
yes, please.
access to information is a really important and challenging situation for anybody. I think the information around the CERB, for example, is mostly disseminated in English and French. So many grassroots and community-based organizations, they are having the burden of translating this to the communities they work with in
Yes.
different languages. When it comes to the threat of deportation, this really intersects with power dynamics that are already in people's lives. So anyone who's experiencing family violence, abuse from their employer, it's very easy to be intimidated if their employer or a family member who's abusing them is threatening them with deportation. Even if they hear about it or they happen to read the news, CBSA, the Canada Border Service Agency, they have not publicly announced that they are not detaining and deporting people, not in a kind of like deadline situation where they'll give us a date. They haven't given that kind of assurance. But certainly within families where people are already being abused, and there is a lot of employer abuse, we see this in the caregiver program as well, this information, the lack of access to this information can be used as a powerful tactic to commit abuse.
Rupaleem, can I get you to follow up on the issue of gender? Well, I don't know, so I'm going to ask. Would non-status women face a disproportionate burden to non-status men right now?
I mean, I think that anytime we have gendered inequalities, these are going to be kind of magnified in a crisis like this. Because the patterns of immigration kind of hook into existing gender inequalities, what we see is more immigrant women come into Canada with a precarious status. They're dependent on a spouse or an employer, and that makes them vulnerable to losing their status or being under the control of that sponsor, whether it's an employer sponsor or their family member. We also see the challenges of family members, women who are caregiving for their children here, or they're separated from their family members. So many women with precarious status enter Canada, they have to leave their children behind because entering as a family, so people who are entering into jobs that have lower pay are not allowed to bring their family members. So these are kind of multiple ways that it is very gendered and disadvantages women. When we're thinking about domestic violence, the options to leave an abusive situation are very hard. I know you had an earlier program talking about domestic violence, and we've seen around the world it has only increased for women and children, particularly when they're forced to stay at home with people who are abusing them. If people are afraid to go to the police, if they don't have access to a shelter or can't afford to or are unable to work, how can they seek out a situation of finding safety? So these are many ways that we need to make sure that everyone has an option to call the police without fear of that information being shared with immigration. So not sharing information with immigration authorities, to make sure people can access healthcare similarly without fearing that healthcare information will be shared with immigration authorities, and providing emergency housing and shelter for anyone leaving an abusive situation.
Okay, you two have done a
Steve,
good job
young,
here.
young
Forgive me,
women.
Francisco. We're down to our last few minutes here, and I want to make
Okay.
sure that we save time because you two have laid out the issues very clearly and very well. On the chance that there are people watching this right now who may be in a position to actually do something about this, Francisco, start us off. Give some policy advice to people on what ought to happen going forward.
Three areas. One is Ontario works for all. That's a position that the province can do. Anybody need to have access to the basic income, and Ontario Works is the place to do it through transfers from the federal government. The other one is the Ontario province said that anybody have access to healthcare. You know, in this particular pandemic, regardless immigration status, regardless the medical condition, please keep it. because this is a social health issue, and we have to not let anybody behind. And the other thing that we can focus is education. There is youth that have been left out of this, and they are bored and totally waste in their future. Open up the education and make it accessible to anybody, non-status or yes, regardless immigration status, and this is going to be better when we left out of the COVID-19.
Well, let me just pick up on the last one. Surely that can't be too tough to do. I mean, nobody's going to class anymore. All you need is the right, whatever it is, PIN number or something to be able to access online courses. I mean, surely that's an easy one, isn't it?
Well, you may also need
Yeah,
the computer and the internet access,
and you
and
have
then
to
a
have,
space in your
and
home to be able
plus,
to
I am talking
train.
about post-secondary education as well. You know, the university has to open up to our youth that don't have a status and don't have a way to obtain a student permit. So why? Because there is a pressing issue in society for this.
Okay, Rupaleem, what would you add to that list?
Absolutely. I think building off of Francisco, I think this is actually an opportunity. It's so unique for us to have a moment where we really are understanding how intertwined our lives are and to open our eyes to the inequalities that we've been tolerating. And I think creating a better society is really an opportunity for us right now. And I think, as Francisco was saying, relaxing the restrictions on access to healthcare are just paramount. We need to make sure that these endure. The waiving of the 3-month time period to access OHIP, for example, providing emergency healthcare to everyone living in the province. These things, there's no reason why these things should go away as the threat of the pandemic minimizes. I think I'm worried about the kind of slow opening up. Although I think there are some economic reasons why businesses need to get back in shape. But I'm worried about those workers who don't have adequate labor protections. We need to have stronger oversight, especially workers working in the homes, in long-term care facilities, workers who have precarious status, making sure that they have access to the basic benefits. So I know the Migrant Workers Action Alliance, they've put out different suggestions. So the federal government should be working with these grassroots groups that support migrant workers, making sure that all workers, especially those non-status or temporary workers, have access to financial support, and also ensuring that we have the adequate housing and healthcare supports as well. I think this is a time where we have the political will to change things for the good, not just in this emergency, but for our future as well.
Rupaleem Bhuyan, can I tell you that it was great to meet you for the first time here, so thank you for joining us on TVO tonight. And Francisco Rico-Martinez, you reminded me before we started that the very first interview you did when you first came to Canada nearly 30 years ago was with this kid who's hanging out in his attic all the time these days. And it's so good to see you again, my friend. Mi hijo, I would say.
Thank you, Steve.
Be
It's
well,
always
both of
nice to
you,
be
and
with you.
thank you so much, as it is with you. Take care, both of you, and be safe.
Thank you.
Thank
Have a
you.
good day. Bye-bye.
Have a good day.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.